Valley Medical Center is one of the largest employees in our region, and we're a leader, and we know that. We know that we set an example and a tone for the community. So in everything we do in our community-based organizations, we try to bring the message of a healthier lifestyle, a more active lifestyle, a better nutritional lifestyle.
Wellness is a very important ingredient to, I think, recruitment and retention, and for well-being for the entire staff. Which is the primary reason we initiated this fitness center here a little bit more than 25 years ago when we opened this building.
We are in the final stages of a major remodel and transformation of the fitness center here at Valley. We have about 1,300 members, and of those, somewhere around 400 are Valley Medical employees. And I'm really proud that during a time when resources could be spent on a lot of things, that Valley really understands the importance of looking at health and wellness and the prevention of disease.
We have an amazing fitness center. It's a full gym with classes. We have yoga, we have massage therapy, we have a full Olympic swimming pool with water walking, low impact classes.
Well, as a nurse, one of the biggest things we always tell people in our profession is self-care is so important. In order to provide the best care to our patients, we need to make sure we're providing great care to ourselves as well. So having access to the fitness center that I can go to during work hours or during my lunch break is fantastic. It's a way that I practice my own self-care. You know, get on the treadmill or taking a class or lifting weights or doing yoga. Really getting to pay attention to myself and my own health so then I can be a better nurse, you know, to those people that come here to Valley.
The Community Transformation Grant was a process within our department in food service. It took all of us to make this big change. We made a sticker that was go for it, so it identified all our healthy items in the cafe.
So as part of the Community Transformation Grant, it gave us some very stringent guidelines when it came to the types of foods that we serve here at the hospital and what went into those foods, how much sugar, how many carbs, how much fat.
And then we took on the initiative of healthy beverages.
We don't have sweet sugary drinks in our vending machines anymore. We have healthy snacks. So whenever we work with the community on a health initiative, we try to bring those ideas and concepts in-house and work with our employees.
So lifestyle medicine is a fairly new focus in healthcare, and really it is looking at how we can prevent most of the major chronic diseases that face people in the United States and really globally.
We know that if people do eat healthy and they're exercising and they're taking care of their physical health, that they're going to do better emotionally as well.
So much of employee health, we work with our mobility coaches, our ergonomic instructors, and they're our lift team. They're the biggest promoters for our safe patient handling program.
We want to make sure that the employees here are safe, what they do in their work field. So to do that, we incorporate many of the exercise size programs we have here, and so they could promote the reduced injury, and also they are knowledgeable about how to use proper body mechanics in their work field.
So the lift team, basically what our role is, we respond to calls from nursing staff, physical therapy, occupational therapy.
So we have a wellness committee here at the hospital and really focused on little things that they can integrate throughout the day. So things like taking the stairwells. We have a program called Mount Valley, and we have stairwell signs that really encourage people to take the stairs, that give them a little encouragement as they go up and down the stairs, that they're doing a good job and to keep it up.
In employee health, Valley has supported the goal that all healthcare workers be immunized against flu because they're caring for patients, and we don't want anyone to have flu transmitted by a healthcare worker. We have a program that went from about 60% of our workforce being vaccinated, and last year we were 97%.
So we're really excited that this year we got named with the Gold Award for a fit-friendly workplace by the American Heart Association. They give you several guidelines that you must meet in order to qualify for the award. And it's things like what percentage of your staff is tobacco-free? Do you offer healthy activity and nutrition options in your facility? Do you encourage healthy activity through your benefit plan?
Adopting a philosophy of a healthy workplace has benefits long before you'll see any measurable improvement in this health status, or maybe even before you'll see a reduction in the cost of your healthcare program. But if you structure it correctly, you'll encourage people to do the things that are healthy for them. Taking a health assessment, becoming aware of what your issues are, smoking cessation programs, flu shots at work for free. Make it easy for people to stay healthy. Include preventative care, include dental care in how you incentivize people, and it will come.
When it was first brought to my attention, when I got the first request, could we change the menu in the cafeteria, and could we expand our fitness program and make it a much more comprehensive wellness program? Well, that was a no-brainer. It's like, do I want to wake up in the morning? Sure, why not? It makes great sense. It's part of an enriched life and helping people feel good.
Another thing that brought us to where we are today is escalating healthcare costs. They really were out of control. And when you look at where we were 2 years ago, we've dropped our healthcare costs about 8%.
One of the few companies in the Northwest, and maybe any place in the country, who have actually not just stopped their increase in healthcare costs, but we've been able to reduce it. And a lot of that is by working with our employees and giving them options so that they can make the choice about how those dollars are spent. Incentivizing them to do healthy things, incentivizing them to think about how they spend their healthcare dollars will really have an immediate effect on your financials.
Here at Vally, we have a lot of employees who also like to do things in teams. It's a great activity because it encourages teamwork outside of the hospital, but it also encourages healthy activities. We have a group called Team VMC that does all sorts of things, from dragon boat racing to hiking to skydiving and mountain climbing, mud runs.
I am Stacy, and we are Vally.
I am Liz, and we are Vally.
I am Ann, and we are Vally.
I am Jamie, and we are Vally.
I am Lisa, and we are Vally.
I am Danette, and we are Vally.
I am Victor, and we are Vally.
I am Nancy, and we are Vally.
I am Megan, and we are Vally.
I am Flora, and we are Vally.
I am Jerry, and we are Vally.
I am Rich, and we are Vally.